Okay, so we'll get started now. So nice to meet all of you. My name is Callie, and I'm a program coordinator here at the Congressional District Health Dashboard. I am recording today's session, and so if you're unable to stay for the whole time, or if you want to rewatch any of these walkthroughs later, I'll be sending them out to everyone that registered afterwards. So be on the lookout for that. If you have any questions throughout the presentation, feel free to just put it in the chat, and I'll get to those at the end. Or if you want to take yourself off mute, I'll be having a Q&A session after I go through kind of the walkthrough and everything. And so feel free to just take yourself off mute at that point. I'm going to be keeping today's session very informal. I expect it'll be a pretty intimate group, but people coming and going throughout. So if you have specific areas of interest or specific states or districts, just let me know, and I'm happy to kind of walk through those with you, and show you how the dashboard can really help you out in your work. So for today, as a little rundown, I'm going to introduce you all to the dashboard. I'll give you a brief site walkthrough of just some of our top features. I'll go through some data examples of how you could use the data and work. And then we'll close out, as I said, with the Q&A where we can dive a bit deeper into people's interest. So what is the Congressional District Health Dashboard? We basically are a dashboard that formed to address the fact that nonpartisan data at this level, the congressional district level, didn't exist. And so we really wanted to make that available because we know that data can really help illuminate challenges, help show successes, and really help people in their work. And so we came together to address this challenge, with the goal of providing unbiased, reliable resource for people to use and help in their priority setting. And so data itself is super powerful tool, but by itself, it can't change policies. It is a super helpful ingredient to changing policies. Data can help illuminate challenges and assets in communities that may have otherwise been hidden. Data can help inform effective policy solutions. What might work in one community might not work in another, and the data can really help highlight that. And then data can also be used to hold leaders accountable. Are they living up to their commitments and their responsibilities? And so this is why we really felt it was important to have a dashboard that fostered this data. So we're really targeting with this dashboard elected officials and their staff, advocates, journalists, researchers, media, and the general public. We've tried to make this as accessible as possible, and we've tried to be as national as possible, through every step of the site journey, so you can really get any data that you're interested in. We previously, 5 years ago, created the City Health Dashboard, and that's our sister site. The City Health Dashboard covers over 970 cities throughout the US and have broken data down at the city level. So we really built off of our learnings from that site to create this site for the more federal and national level. Currently, the Congressional District Health Dashboard data are drawn from federal sources and other data sets, and we make sure that every data source that we use adheres to rigorous standards of data collection and analysis. So some of those sources include the US Census Bureau, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. And those are just a few. And every single metric that we have on a site, we have more information where you can learn more about the data source, what years of collection we're using. We also provide all of our technical documentation and code books. So if you're curious on how we actually calculate it or why we made certain decisions with the data, you can find all of that easy access on the site. Our team here is a team of population health and policy experts, epidemiologists, and geospatial specialists, and we regularly update the dashboard with new years of data, new measures, and other relevant policy resources so that we can make sure to be as relevant and up to date as possible for all of you guys. Currently, our site has 35 measures on health and its drivers. We provide demographic data for 15 of those measures, and for many of the other measures, we also provide multi-year data, and as well as data broken down by census tracts or neighborhood level data, as we call it. So this is just a layout of the data that we do have. And as you can see here, we break down our data into 5 overarching domains, which are health outcomes, social and economic factors, health behaviors, physical environment, and clinical care. And those are kind of the big overarching domains that we feel like all of our metrics fall under, but all generally fall under the bigger bracket of health. So we created this site earlier this year, so we're almost up on our 1-year anniversary. We developed it in partnership with the Robert Wood Johnson Foundation, as well as our bridging partners, the Bipartisan Policy Center and the Center on Budget and Policy Priorities. So without further ado, I will now take you to the site and we can walk through it and see what all of this talk is about. So here you are at the Congressional District Health Dashboard. You can start here by typing in your district, or very soon upon our newest release, you'll be able to kind of just find it here. If you want to know what district you are, you can always just type in here if you don't know. So otherwise, you can start out here. We'll start out the metric maps because I think that's one of the coolest features that we have. If you click on the metric maps at the top, it'll come up all of the 35 metrics here, and you can click into any of them of interest. Today, I've heard a lot about absenteeism rising in schools, and so I'm curious about high school completion rates throughout the country and what that looks like. So if you click here, what will load will become the national map. You can move around here with your cursor. If you want to see Alaska and Hawaii are also in here, and they're coded to this scale bar at the top. Now, what this scale bar tells you is that up here, higher values indicate better outcomes. So for this particular measure of high school completion, that means that the more people that are completing high school, the better the outcomes. And in this case, the lighter colors are always going to be at the better values. So in here, the lighter values are going to be places that are having higher completion versus the darker colors are places with lower high school completion. For this metric, we have multi-year data available. So that means here on the left-hand sidebar, you can compare between years of data that we have available on the site to see if there's any differences. You could go in here and type in, say, if you want to look at California, you could type in the state or any specific district of interest, and that'll bring you to a different map that just highlights specifically that district. So it's a little less distracting than having every single thing populated on the national map. Something else that I think is really interesting and super useful on our site is that we have availability of census tract data. So for instance, I know Wyoming is a district that is at large. And so that means that this state isn't broken down into different districts, but rather the whole state is one congressional district. So sometimes when you're looking at one district that's the entire state, it seems like they're doing very well, which is great, but maybe you want to see what does that actually mean for the state overall. And that's where the census tract data can be really useful. If you click this is actually going to now break down Wyoming's at-large district into the neighborhood level data. So you can see anything you kind of want here. You can go all different levels from national to state to district to census tract. It's all here on the site and super easily accessible. Again, you can go between years and this will load again in the same way. And then the last kind of feature here that is interesting is that you can go, this one is a little hard to see with Wyoming, but you can look right now, we're looking at the US state average, the US average, but we can also compare it to the state average, which in this case, because it's an at-large district, it's showing the same value. If you want more information about the metrics, you can click over here. It'll tell you more about the metric. This is the year it's calculated. It's a 5-year estimate, the original source of data, and you can click into this more about the metric to see a bit more on the strengths, limitations, how the dashboard team calculates it, and any relevant references. So that's the metric maps. If we go to metrics by demographics, if we go back, we'll stick with Wyoming for now. And we see here that there are quite a few metrics on our site that have the demographic breakdowns available. And so if we're sticking with high school completion, we can go in, and this provides high school completion data at the district level for breakdowns of sex, as well as race and ethnicity. And this can be really useful for you to see, what demographic groups is this affecting the most? And you can compare across groups. Again, you can also go between years to see how have things changed in my district. One of the last things I'll cover, so is this district snapshot, which I think is a great way to have an overall idea of how your district is doing. We'll just stick with Wyoming for now. Let's say we want to see Wyoming at large. So maybe you don't know what specific metric you want to look at, but you know you're from Wyoming or you're from another district of interest. You can go to this district snapshot page. And what this page does is it lists all of the metrics on our site in alphabetical order. So if you just want to kind of peruse and see how your district is doing, this is a really great way to do it. And the other great thing about this page is that it'll show you visually if your district is doing better than average, around average, or worse than average for any particular metric. And those are described here with these symbols. So the green circles are better than average, red squares are worse, and the triangles are around average. And as you see this green symbol here, you can hover over the better than average and it will tell you the US average. In the middle column, it tells you the district average. So here we can see for air pollution, particulate matter, Wyoming is actually doing better than the US average. If you scroll down, you can see that Wyoming is a pretty average district overall, but there are a few places where they're doing slightly worse or slightly better than the US average. And this is a really easy and great way to kind of just get a general sense of how your district is doing. Another thing that you can do here is that you can filter. So say you're interested only in physical environment metrics. Now it'll break it down by just our physical environment metrics for you to see. And last thing that I kind of wanted to highlight, oh, actually, before that, the other cool feature of the district snapshot is that you can also see any specific facts about your district. So this will show you a breakdown of the age of your district members, as well as race, ethnicity. And then it will also show you the current representation in the House and the Senate for your district. So this is useful. This information is updated as soon as elections go through, and these ones are updated every time the site. So everything is as up to date as possible as the data provides for us. So you can be reassured that everything you see there is really up to date. The last thing I'll show you is that all of this data is free and available to download at any time on our website. You just go here and access the data. And once you're here, we provide, as I said previously, the codebook and the technical documents. So if you want to know kind of the nitty-gritty details of how do we calculate all of these data points, why did we make certain decisions, where is this data coming from, that's all found in these two books. It's a lot of text and details, and it's fantastic if you want more details. It's also something that we've tried to provide on the site in a more lay-friendly manner if you don't want all of those nitty-gritty details. And then down here, everything is available for download. So you can either download every single district, so this includes every metric for every congressional district on the website, or you can download by state. And so this will provide all of the congressional district data for the specific state that you decide to download. As always, if you have any questions at all as you're kind of going through the data, and if you need any help, we're here. My team is here to help walk you through that, to make sure that you understand, what's happening. It's a lot of data, it's a lot of numbers that can be super useful, but, sometimes it takes some time to really understand what's happening. So that's the Congressional District Health Dashboard. So continuing on, I'll just spotlight some cool data points. We had a data release and update this summer. And so that was when we added the census tract data for 24 of our metrics. We added a new year of data for 22 of our metrics. And then we also improved, based on some user feedback, we improved some user experience points on the metrics overview and metrics maps page. So we're always listening to what people have to say on how they can better use the site. And we hear you, we listen, and we try to update it so that it's as useful for you guys as possible. Some cool data points that we found as we updated the site was that now we were able to do multi-year comparisons for metrics. And so we took a look at uninsurance rates. So this metric on our site, it measures how many people in the population do not have health insurance. So they are considered uninsured. And we found that between the years of 2020 and 2021, in the Texas's 2nd district, there was the greatest increase in the amount of people that were uninsured, versus in New York's 17th district, there was the greatest decrease in the people who were uninsured. So this is like an interesting way to compare between districts, not between districts, between years and certain districts to see, is uninsurance increasing? Is it decreasing? And that's something that you can now do on our site. Another cool thing that we found is that with the availability of census tract data, we're able to look at some of those higher performing districts for certain measures and really break it down by neighborhood. And so what we did here is we looked at broadband access, which is high-speed internet access. And we found the top 5 districts who performed as the highest broadband access in the country. And we found that actually when you look at, for instance, the number one district in 2021 for broadband is Virginia's 11th district, we found that when you look at those neighborhood level, there's actually a very wide range of access to internet at the neighborhood level. So that can give you a better idea of places that are successful. There's still always, areas that you can work on and areas that you can learn from. And so this is a really exciting way to get even deeper and more granular into the data than just simply looking at the district level. So that's my spiel. I'd love to hear from you guys if you have any questions, if you have areas of particular interest that you want me to kind of walk through or show you. Feel free to take yourself off mute or put any questions into the chat. And otherwise, thank you so much for joining us. We are always available for any questions or anything at our info@cdhealthdashboard.org email, and otherwise we're here on Twitter or X as well as LinkedIn, or you can subscribe to our mailing list. So yeah, I'll stay on for the rest of the time, but feel free to hop off if you don't have questions, and if you do, hop off mute or put them in the chat and I'm here to answer them. Thanks for joining. Thanks for your input, Shaquille. I'm curious to hear where you're coming from, if you have any associations with any states, districts, or organizations. If you want to pop that in the chat, I'd love to know. And Luann, I see that you put a question here. Do you anticipate in the future adding other outcome measures such as asthma? So the short answer is yes, we are always looking at adding new metrics. We have a very rigorous kind of background checking and metric checking to make sure it aligns with all of our standards. So part of our data team here is always looking at how do we expand these measures. And I know that asthma and other kind of health related concerns, especially, no, asthma has definitely been top of mind. They're really looking into seeing what sort of data sources are out there so that we can add that to the site. Unfortunately, we don't know when it'll be added to the site, but we make sure to let everyone know as soon as there is a data release or a site update through our mailing list. So I'd say the best shot to know when that comes out is to join our mailing list. But we do definitely anticipate adding new metrics in the coming year. So be on the lookout for that. And always, if you have suggestions for other metrics that you think would be helpful to have on our site or alongside these ones, be sure to just reach out and let us know, and we'll put it in our little log of what people are looking for. And yes, let me add the subscribe link right now in the chat.